Okay,
Yeah.
sounds good. All right. Well, welcome everyone. It's my pleasure to have you on this websode of Lunch and Learn. My name is Will Casterlo, and I'm the lead cybersecurity expert and founder here at Triad Cyber Solutions. We are a managed security service solution provider. So think of us of a team of cyber defenders. We're working hard to keep the bad guys out and help keep people like you safe from these malicious acts. We're here to make sure that your digital world stays secure so you can focus on what you do best. In this webinar, we'll cover the ins and outs of HIPAA compliance. With the new updates, it's super important to stay on top of the things to avoid any financial reputation hits. So we'll help you understand what you need to do to help keep your health practice safe and compliant. But I want to start here. I'm not here alone today, so I have my team members here on this website. They're here to address all questions and concerns that you may have in the chat today. Here first, we have Chantel. She's our VP of Operations and Client Relations. Then we have Wasim. Wasim is our Senior Technician. We have Ralph. He's our Marketing Manager and Web Designer. And then we have Micah. She's our Executive Administrative Assistant. Their unique skill sets make our workflow like silk here at TCS and help us serve our clients efficiently. So I appreciate them for being here today, and I'm certain that you can't wait to know more about HIPAA compliance. So let's get ahead and dive in. All right, today we're going to cover the essentials of HIPAA. By the end of this session, you're going to understand, one, what HIPAA is, two, the HIPAA security rules, three, the common HIPAA security challenges and how to overcome them. Four, we're also going to share the updates. Okay, this is very important you listen to this part. We're going to share the updates to help you know what areas to strengthen your security. And then we're going to cover the tools and techniques for staying compliant. If you have any questions, feel free to drop them in the chat during the session. My team will be monitoring this and be ready to respond. For more in-depth questions, I recommend waiting until the end of the session, where we'll have a dedicated Q&A section. All right, so we're going to go ahead and look. So what is it? Okay, HIPAA, what is it? And why is it put in place? HIPAA was originally introduced into Congress as the Health Insurance Reform Act. Due to the concerns of potentially exposing patient health information, also known as PHI, to hackers and patient management becoming more digital, several amendments were then made to make the Health Insurance Portability Act, also known as HIPAA, what we know today. But why do we need it? The truth is that failure to keep your patient's health information confidential can result in severe long-term consequences for your organization, such as legal penalties, loss of patient and professional trust, and financial damage. We've seen companies get hit hard for HIPAA violations. For example, back in 2020, the premier Blue Cross had the biggest health plan, one of the biggest health plan of Pacific Northwest. They paid over $6.85 million in fines due to a data breach that affected more than 10.4 million people. So that's huge. Even more recent, the United Healthcare group breach that happened in Q1 this year, if you remember, you possibly were affected, okay? That cyber attack cost around the range of $870 million. We're just talking about, this was back in January or February this year. So I think it was even more, about 600 million that were affected and had to be restored. But a lot of response efforts was seamless and it was awful. So the rest of it was all revenue loss and business interruption. Both of those incidents are a big reminder of how crucial it is to keep patient information safe behind multiple layers of cybersecurity. So for the medical and health and wellness industry, HIPAA provides you with a step-by-step guide on the security measures that will reduce your chances of encountering data breaches like this. Now, HIPAA has plenty of rules, so many, too many to go through and talk about today. But we're going to hit on some great key points of today's session on what is really important and why you need to look at it and be focused. Okay, so missing these could really throw a monkey wrench in your business. And this is where we start when we come into any business as a cybersecurity management team. First, we have the security rule. Think of this rule as a hospital's infection control protocol. But instead of protecting against germs, it protects electronic protected health information, known as EPHI. Just as an infection controls and prevents disease spreads, the HIPAA security rule prevents unauthorized access to sensitive health data. Just as infection control measures include handy hygiene, sanitation, and isolation protocols, the HIPAA security rule requires a multi-phased approach to data security. This protects administrative safeguards like risk assessments, policies, training, physical safeguards. We're talking like security facilities and access controls. And then we're talking about technical safeguards. We're also looking at encryption, firewalls, and secure communication channels. We will talk about the privacy rule. This is a diary lock or a lock for your safe. It's a physical barrier to unauthorized access. The privacy rule establishes boundaries and safeguards for health information. It requires healthcare providers like yourself and organizations to implement policies and procedures to protect patient privacy. This is including, but not limited to, ones who can access health information and how it can be accessed and used or disclosed. This lock ensures that only the person who holds the key to it can access the private thoughts and feelings inside. It's just like a diary. So it locks personal thoughts, but the privacy rule safeguards individuals' health information, keeping it confidential and secure. Now, finally, we go to breach notifications. Imagine a breach notification rule like, sorry, we just messed up. Well, that card and healthcare providers have to send out, you have to send that card out, it's a data breach. This rule requires healthcare providers to notify affected individuals, the Department of Health and Human Resources, and in some cases, the media. If there's been a breach of protected health insurance, it's a crucial step in quickly addressing it, mitigating the impact of data breaches. So, just so you know, breach notifications must be issued without unreasonable delay and no later than 60 days after discovering the breach. Not having cybersecurity that follows these rules is a massive fumble. When you get hacked, and I mean you will get hacked, your patients, your sponsors, your board, and your community are going to want to know why is this going to hemorrhage all of this money? Hackers will take everything they can to get their hands on it. So starting with these 3 rules, is the best way to implement multiple layers of security that will limit the data that hackers will have access to and minimize damages. Here we go. This is definitely something, oh, I'm sorry. Number one, HIPAA has plenty of rules, but we're honoring it in the top three right now. So missing these can really throw a monkey wrench in your business. And again, this is how we start, where we come into any business as a cybersecurity management tool. First, we had the security rule. This rule as a hospital's infection control protocol. This is definitely something you want to stay on top of, so you don't end up playing the whoopsie daisy, our bad card, and baking cookies, giving out candy, whatever you can to try to smooth things over because they know, or you don't want them to know, there's been a hiccup or a mess up. So year after year, healthcare providers face ongoing challenges, often paying hefty fines for HIPAA non-compliance. Some businesses can't even bounce back and they end up shutting down entirely. Take the 2019 data breach at AMCA, for instance. 21 million individuals were affected, and the company ultimately went bankrupt. This is why it's so important to understand these challenges and how to tackle them. Now, one of the biggest security challenges businesses like yours face is employee awareness training. Some employees aren't fully trained on HIPAA compliance, even what the best practices are for protecting sensitive data in or out of the office, which means they're definitely not aware of the most common attack methods that result in patient data being exposed to attackers. Now, you know, sometimes hackers send those sneaky, fishy emails. I'm sure you've seen those. Well, some employees may not even realize and end up clicking on those bad links in those emails. That gives the hackers access to your company network. As soon as you click on it, they're in, which can lead to data breaches, exposing protected health information attackers. I'm not sure if you heard of this, but the University of Utah actually experienced a data breach that affected 10,000 patients. That's 10,000 patients, and that's a huge university. The breach occurred after an employee clicked on a phishing email giving attackers access to the organization's network. It only takes one person. I need you to understand that. Doesn't take a lot. One time, okay? A lot of people think that they can just implement security systems and put their verification code in and log into the email and everything is secure. No, that's not it. Yes, those systems are like walls. They're permanent. Once you put up a wall, right, the most you should have to do is maybe repaint it, maybe add some, cover up some scratches here, some nail pops here, molding. But regardless, the wall is still there, right? But for your employees are doors. They are attached to the wall. So still there's a part of the house that you need to make sure have deadbolts and knob locks. That's where the cybersecurity training comes in. Keeping with your cybersecurity training is like being in a house. Operating your organization with outdated systems and software is like letting your house fall. If your building materials get old, they start to rot and let pests in, and then they devour your house inside and out. When you start seeing the little gnats, the little bugs coming around, when you start seeing the cracks in the wall, you have to do something. You have to fill those, not just doing it bootleg, but you need to fill it properly. Not doing it properly will just give you a temporary solution. However, when doing it as a temporary solution, you eventually got to do it again and fix the previous solution that you fixed the first time. So depending on what devices, okay, we're talking about here, lifespan can vary. But let's say that you're still using the computer you bought 9, 10 years ago. That's not going to cut it anymore. One good thing is Microsoft they have their security measures. They have provisions that you have to update and upgrade your PC every so often. Because why? They won't run the certain operating systems. But by that point, a lot of the operating systems have new OS updates that are no longer compatible with your system. Not only that, but all the software that you use, your M365, Theranest, Simple Practice, or even in-house softwares will also have the robust security updates. If you don't do those updates, it can cause your browser or your software not to function properly. It can cause files not to update or update into your system properly. It can cause coding issues where your file that you updated or the pictures that you updated into the customer's profile looks like code. It looks like a coded message. So if your company computers can't handle those updates properly, you need new ones that can, because technology is going to keep advancing and it will leave you behind. So if you want to try to nickel and dime it, or you're like, well, this PC is only 6 years old, it's still running good, you're putting yourself in a vulnerable situation where you can be hacked. But because your computer lacks the latest security patches and updates, you can become more vulnerable to attacks. Hackers target these vulnerabilities to gain unauthorized access to sensitive patient data, leading to breaches. So these breaches not only compromise patient privacy, but also expose your business to several penalties and reputational damage. I just mentioned that to you previously when we were talking about the University of Utah, where we were talking about the Blue Cross Blue Shield. They sustain reputational damages. Now, for example, Acilion, a widely used file transfer vendor, was targeted in a cyber attack that exploited vulnerabilities in their outdated software. This had serious consequences, especially for the healthcare providers who relied on Acilion service. Organizations like Central Health, Regional Health Authority in Newfoundland, and Labaro, Canada, the University of Colorado Medicine, Stanford Medicine, Health Share of Oregon, and many others were affected. All right, now, the insider threats are just one of the most uncomfortable threats to talk about with business owners. That's because none of us really want to believe that someone from our team will be the reason for a network breach, whether intentional or not intentional. The word intentional is where a lot of people get tripped up. Insider threats are security risks that originate from within an organization, typically involving employees, contractors, or business associates who have access to sensitive data. One of the things I want to talk about is now this day and age, since COVID, we have a lot more remote workers than we've ever had in our age of working employment. How do you feel and how do you think they will be if they're not covered because they're working with outdated software, or they're working with not a company laptop or computer? These threats can be intentional, such as when employees steal data from personal gain or unintentional, such as when employee accidentally exposes sensitive information. So what do you have in place in the event that you have an employee that exposes a piece of information about another client that you have no control and you didn't even know about? How do you control that? I'm gonna give you another scenario. In 2023, Tesla. Tesla had a big security breach. Two ex-employees leaked personal information of over 75,000 current and former employees to a foreign media outlet. That's 75,000 employees. And these are two employees that no longer work for them. So how did that happen? Why did it happen? Tesla did not lock down the process to make sure that the unauthorized access was was part of the security plan. What they did is they spilled names, addresses, phone numbers, and even social security numbers. Plus, they let out customer bank details, production secrets, and complaints about Tesla's full service or full self-driving features. The ex-employees got hit with legal action, but Tesla's reputation took a big hit. Yeah, of course, you can send them to court. You can take them to court and try to get them. That does nothing compared to the reputation now that your business or your organization's name is now in the headlines. Okay? It's not. So even if you are an employee, either you were invited by your employer to this webinar, or you chose to be proactive and educate yourself on HIPAA. You can also be held liable for these breaches. So you may even face financial or judicial consequence that could ruin you personally. Now, for employers, you will still be the most liable, so don't think you can just shove it off to someone else. You are responsible for protecting your community. You should also feel some sort of responsibility for your clients or for your patients and your team. Those are the real people and hackers, and are the real criminals. Do not be the reason that your community is faced with a criminal offense. If you, as a lawyer or as a doctor or a nurse, the people that your community turn to in their most vulnerable moments, willfully ignore following the HIPAA guidelines and refuse to protect them, you are forsaking your duty to protect them, and then they are not going to trust you anymore. So what are you going to do? How do you want to manage your risk? Well, I wouldn't trust anyone anymore, right? I would hope that you would feel the same if your doctor or your lawyer or your nurse put you in that position. I'd hope that you go to someone who care about more about you, right? Who has a higher level of integrity to at least try to do the right thing and make sure that their company's due diligence has been met. But if you're just learning about these for the first time, I'm not shaming you here at all. You can't help what you don't know, but getting a good.
All right, one moment, everyone. It seems that we're experiencing some mic issues. Just give us one moment while we figure figure that out so that you guys don't miss anything. All right. Well, we still can't hear you. So maybe try muting your mic real quick and coming back on. There's also in the settings, you should be able to um, find like audio settings and maybe try to reconnect through there. Potentially leaving the meeting and then coming back on might help. If everyone could just give us just a few seconds. Once again, I thank you guys for waiting here. Hopefully everyone's having a good day.
Okay, can you hear me now?
Yes, perfect. We can hear you now. Can everyone else hear? Perfect. Okay,
Sorry
I'm
about
seeing
that,
some.
everyone.
No worries. All right,
All right. Can everybody still hear me?
I can hear you.
You hear me? Okay. Give me a second
I'm seeing some
here.
reactions in the chat as well that people can hear you.
Okay. Sorry about that. Let's see. Trying to see where I left off. Okay. Okay. All right. We can still hear me?
Yes, we can still hear you.
Okay. All right. So sorry about that, y'all. I think it's a Microsoft Teams issue, software. So,
No worries.
but we're gonna carry on. Hopefully, this is where I left off at here. So, but I want to go back and just kind of reiterate just a tad bit of what I was talking about. Um, but again, talking about the real reasons. Again, if you're just learning this, okay, if you're just learning about this for the first time, again, I'm not shaming you at all, and you can't help what you don't know, right? But getting a good grasp on these systems and these threats is the first step to tackling your cybersecurity. I actually applaud you for coming here today to learn, okay, what you're up against and what you're going to be looking at, okay? Now, we're going to talk about these 2024 updates so we don't have to be baking cookies and trying to give some candy and donuts and stuff because we end up paying hefty fines to someone and we got to cover up our issues of our negligence because we didn't do anything at all, right? So we don't want to do that. So now we're going to go ahead and deep dive into some of the HIPAA updates that has happened. So in 2024, is one of the big updates that majorly impacted HIPAA. It's really important to stay on top of these changes because not only not knowing the latest rules won't get you off the hook for any HIPAA violations. So again, if you're in this session, this lunch and learn today, and you did not know about that, not knowing what these updates are not going to get you off the hook. Okay, you're still going to get a violation from the federal government or from the state and from the HIPAA guidelines compliance. These changes took effect June 25th of 2023, and they started being more strict They started being more strict and enforced on January 1st of this year. So the key to HIPAA compliance rules changes are these, right? We're talking about HIPAA regulated entities. The HIPAA regulated entities must obtain a signed attestation from requesters of protected health information related to reproductive health care, confirming that the information will not be used or disclosed or prohibited purposes. Okay? Violating these requirements is considered a criminal offense of the Social Security Act, with a maximum penalty of $250,000 and or up to 10 years in jail. I know me for myself, there's no way I want to be one near having to pay $250,000. But in two, I'm not even looking at jail. That's a no-no for me. So I'm going to do what I need to do to make sure we're protected, we're in compliance, so we can stay away from this right here. Okay? Patients now have more control over their health information. And now they can check out their PHI in person. They can take notes and images and even request electronic copies of their records. Plus, they can also ask for any corrections to be made or any mistakes. The maximum time to provide access to PHI has been shortened from 30 days to 15 days. Why? Because of the security updates. The security updates back in December of 2023, according to the HHS, they published cybersecurity strategy, outlining what it will be and what you need to do to beef up your healthcare cybersecurity in 2024 and beyond. As part of this strategy, the HHS released cybersecurity performance goals, known as CPGs, in January. These CPGs contain significant measures that HIPAA regulated entities can adopt to improve their cybersecurity posture. The CPGs are categorized into two areas: essential and enhanced measures, with the expectation that at least the essentials CPGs will be implemented. Now, let's go over the essential CPGs that include 7 areas. The first area, mitigate known vulnerabilities. Number 2, email security. Number 3, multi-factor authentication. Number 4, basic cybersecurity training for the workforce. We just talked about that. Strong encryption for data in transit. Number 6, revoking credentials for departing workforce members. We just talked about that also. Tesla, right? And number 7, the basic incident planning and preparedness. Now, we're going to talk about the enhanced CPGs that includes 4 areas. Number 1, asset inventory. We're talking about those outdated PCs, outdated software. Number 2, cybersecurity testing. You got to make sure you have penetration testing going on every single month on every workstation. Number 3, cybersecurity mitigation. You got to have a plan. And number 4, centralized incident planning and preparedness. What is your plan when you do get hacked? How are things going to go and get back to normal? What is your plan? Or do you plan on paying that $250,000 as a first offense or possible jail time, but then you're going to suffer, then the business or the organization is going to suffer tremendously as their reputation gets vulnerabilized like all over the world. So what are you going to do? Well, the 2024 update on cybersecurity in healthcare was announced this spring, and these are the chances. The chances of enhanced CPGs will now become mandatory later on. So just a heads up, I did not cover every single update here. For a deep dive, Micah, are you able to drop the link in the chat for me? This is concerning the new HIPAA regulations from the year of 2023 to 2024. All right. Now, absolutely, as your friendly neighborhood HIPAA doctor, I'm your doctor, right? So I won't leave you hanging with just diagnosis. Because of course, I understand you don't know, because I don't know your field. You're the expert when it comes to your organization and what you do. And I can't tell you how to diagnose or how to treat it until you treat and do your process. Well, that's the same thing for us. We are your HIPAA doctors, okay? So here's a healthy dose on how to keep your business HIPAA compliant. First things first, make sure your team is in the loop. Seriously, you don't want one of your own falling for a phishing email, right? Because they didn't know what it was. They didn't know what it looks like. They didn't know what to look for. Now, believe me, those cyber attacks are very, very clever. They know how to make those emails look legit. You have to study and really look at the emails properly before you open it. Let me rephrase that. Before you open it. Because once you open it, they're in. It's a done deal. The second thing, number 2, we're going to start regularly performing risk assessments to identify potential vulnerabilities in your organization's handling the PHI. Think of this as self-imposing stress tests. See how your cybersecurity holds up and find where you can improve. Try running penetration tests because it's a way to hack yourself than to be hacked by someone else. Now, unless of course you've got $1 million sitting to the side and some really awesome ugly cookies that you want to sit there and give. I know for me, I don't have no cookies, I don't have any donuts, not for this cause, but I don't have any of that to be able to spare because of this. So keeping a close eye on who's accessing and using PHI in your organization is very imperative. You must know. It's your obligation to know. Don't just be negligent and just say, oh yeah, well, I got Mary over here. She's been with me for the last 5 or 6 years. I trust her. She couldn't hurt a fly. Okay, well, if you trust her like that, or you trust John, do you trust either one of them to have access to your bank account and just monitor it just like it is? I guarantee your answer is going to be no. So make sure you follow the concept of at least privilege. So employees only have access to what they need. Step up your security game to prevent any data theft. Set up procedures for securely getting rid of PHI. Make sure that both electronic and physical records are completely destroyed and can't be reconstructed or retrieved. This is just scratching the surface, y'all. Again, this is just scratching the surface of what it takes to stay HIPAA compliant. How many of you can say for sure that your business has covered all of those bases? Put that in the chat for me, if you may, to let me know if you have covered all, if you feel like your office, your business has covered all of these bases.
I know we have.
Yes.
Yeah.
Well,
Oh,
yes.
Donna says yes as well.
Okay. All right. Well, again, I can tell you for free that a simple penetration test will be the judge. Okay. That would be the judge of it. So, how about jumping on a quick call to chat about your HIPAA compliance? Normally, this kind of thing isn't free, but join this website. You can grab a free 30-minute session with me and my team. Micah, can you please drop in the scheduling link in the chat, please? We will also have a QR code on the next slide that you can scan with your phone if that's easier for you. And here's the QR code for you. Okay, for those of you that need to scan. Micah has also dropped the scheduling link there in the chat, so you can schedule immediately before it's too late. Again, this is a free 30-minute session, no obligation to you. You made the first steps by coming and joining this webinar, this website, to see and get to learn at least the ins and outs of the basic of what needs to be done right now. Okay, but a free 30-minute session to safeguard your business versus risking it for the future, to me, that's a choice. That choice is crystal clear. And like, for instance, if you want to just be in a test and see where you are, that is also a great thing. Now, all right, I'm going to open the door for some chat, for some questions. If there's anything that we covered today that you're curious about, now is your chance to ask.
Um, I have one, Will,
Okay.
if I may. Um, Now, I know that we talked a lot about HIPAA compliance uh, here in the medical industry or the health and wellness industry. How much does it also apply to other industries? You know, even the ones who aren't required to do HIPAA. What about these rules would be good to carry over throughout any industry at all?
Yes, that's definitely a great question. This, a lot of people feel like HIPAA doesn't apply to them because they're not in the medical field. But truth be told, HIPAA compliance also falls in the line of protecting people's data, protecting their personal information. CPAs, law firms, car dealerships. It doesn't matter what industry you're in, those industries, any industry that you're in, technically revolves around HIPAA compliance because it deals with people's information. So if you contain any kind of client information of anyone of any sort, if you have their name, that's HIPAA. If you have their address, their phone number, even if you don't have their social security number, that's still part of HIPAA. The FTC safeguard rules is a rule that the federal government has also implemented, which coincides to the HIPAA compliance. So if you're not HIPAA compliant or you're not abiding by the FTC safeguard rules, you're not HIPAA compliant. You're not in compliance, period. So the answer to that question is everyone technically needs to be HIPAA compliant.
Perfect.
Yes.
Perfect. Awesome.
I want to say one more thing that I know there was a question from another potential client that asked me one day. They were like, well, do we still fall under the HIPAA compliancy if we're using a web-based program? So we're not functioning off of a server, like an in-house server, or information is not on the computers, but they're looking at, hey, we have our software that's on the web browser. So we log into a browser, right? And we log in, and then all of our client information, patient information is there. Do we still fall underneath this compliance with the rules and regulations? Yes. The answer is absolutely yes. And this is the reason why. The reason why is even the company. So the thing you can't do is trust. You can't put fully trust in everyone on their processes. I just had an example and I asked you, would you be willing to give someone access to your bank account knowing that they're a trusted friend for many years? That answer is more than likely no, right? So the thing is, even though the organization may say, hey, we're covered, we have cybersecurity in the platform, so when you log in, it's protected. Let's say you're doing MFA, right? You have two-form authentication where you're authenticating going to that customer's platform, that vendor's platform. The problem is your local machines are still vulnerable. Your local network is still vulnerable. You still have the ability when on your machine, when an employee goes, let's say they go to Facebook, they go to Snapchat, Instagram. If they're watching and looking at these things, right? And then they access something there, now it's on the local machine. Well, when you go to open up another window, it could travel into the portal or into the vendor software that's web-based. And the reason why is if your PC has administrator rights, or if it doesn't, as long as it's in your network, it can travel. And it will travel and attack when you at least expect it to know that something has happened. It's a possibility right now, today, when you get off this Lunch and Learn website, that you go back to your PC or you shut this window down, that something is in your PC right now. Especially if you have a webcam or if you have a camera access. If you are connected to the internet and you have basic software, if you're just running Malwarebytes, Norton, McAfee, Kaspersky, ESET, doesn't matter what software. You have one of those softwares on your work machine, I guarantee you, I can run a free security scan on your machine and I can pull up all of your passwords. I can pull up a just amount of data to show you that you are not HIPAA compliant. So what that means is please sign up with the link to just get that free 30-minute call. And I will keep it and hold it to 30 minutes only, not because I value your time. And you'll make sure it'll be the best 30 minutes you've ever invested on a free basis. Let's see, do we have a question? Let's check in and be sure. Okay, no. All right, so I want to go ahead and finish up here. So again, deep diving today. Oh,
sorry to interrupt you, Will. I think there might be a question in the Q&A portion.
okay.
Mhm.
Let's see if I can get there.
I think Micah says, thanks for the insightful session, Will. I enjoyed every minute of it. I do have a question though, because the thing is, I can't run a business all by myself. I definitely need a hand or two. So how do I navigate insider threats? It sounds really scary. And how would we go about addressing that threat?
Yes, so how we can do this, Micah, is first in the chat, we put that scheduling link. The very first thing we can do is schedule for that free 30-minute session. Okay, that'll be considered our discovery call. We'll get scheduled to get on that session, and then we'll be able to talk and go through certain things. But whether you're a one-person show or a 10 or 50 or 100-person show, or business, everyone can be protected. Okay, everyone can be protected, and everyone needs to start taking measures yesterday. Yes.
Okay.
All right. Any
Awesome.
more? Okay, is that going to be it there? Okay.
Yeah, I don't see any more in the. Oh,
Oh,
Wasim.
more.
um,
Let's see.
he put it there in the chat.
Okay. Says why we need a modern why do we need modern security tools to install on our devices and integrate them with cloud's resources? Again, one of the reasons, uh, the attackers know that a lot of people are going to the cloud, right? So just because I gave the example early in the session where we were talking about the walls, right? So you have the walls, but on that door, you still need to have the deadbolt and the doorknob, right? So you don't want to just leave holes in your process of what you're doing. So one of the reasons why is working in the cloud, working on site or actually on your PC, you still need to put the same amount of protections on both layers either way. Okay. So either layer is one layer or the other is neither more important than the other, if that makes sense. So whether it's cloud or local, you need to apply these security protocols on both sides because the hackers work in all ways, all the time. And as soon as they get access, they're going to start working. So that's the reason why.
Great. Yeah, they hackers are relentless that way. They just find they find a crack
Right.
somewhere, and once they're in, it's really hard to get them out. It's really hard to keep them out. Um, it's just better to be proactive about that kind of stuff. Rather
Yep.
do a little work here. I mean, do the work outside so that you don't have to do this emergency response
Yeah.
after it happens. You already know you can feel confident in protecting yourself, defending the people that you serve. Um, yeah, they don't have anything better to do they? Well, the hackers just don't
They
have
have
nothing
nothing.
better to do.
This is what they do. Like this is what they do all
Yep.
day. While we're here to lunch and learn,
Hmm.
they're there on their computers just like this on the screen, and they're
Yeah.
trying to figure out code and trying to figure out your password. That's what they're doing. They
Awesome.
get paid to do that. So this is their game,
Hmm.
and we don't want to be part of that game. So what we're going to do is everyone's going to get hacked. Everybody's going to get hit, but what we're going to do is minimize the risk. We're going to minimize the risk on how they can, how they will, and hopefully they won't,
Yeah.
but you will get hit. And we were talking about, again, my last point is the wall. And we're talking about those little bugs. We're talking about the sealing those bugs so the pest control don't have to come in because once those ants start coming through the cracks, they're all over the place, right? We don't want to give the hackers any type of inclination that they can come in and slip in through email, through login, through your phone service, through text messaging, through any type of logins, your passwords, the whole nine. But I can go in more depth, more deep in depth with you in that 30-minute session. So again, if you do have more questions, but prefer not to post them here, or want a deeper dive into the new HIPAA updates and how to stay compliant, again, consider scheduling a discovery call with us. Okay, just fill out that form. We'll cover everything else from there. Okay, well, thanks again to everyone who has joined us today during our lunch break. Don't forget to please schedule that discovery call if you haven't already. The QR code is there in the bottom left hand corner for those who prefer scanning it. Chantel has already dropped the link in the chat again, but if you can, drop it again just to be sure. Our contact information is always displayed, so feel free to reach out via phone, email, or on social media. Thanks all for now. Enjoy the rest of your lunch and the rest of your day. Again, goodbye, and please do not just not do anything. Again, if you want to just test what you have in place, you already have an IT department, you already have IT stuff in place. If you just want to test it for free, we can give you a free external scan just to test what it looks like on the outside as of right now with everything you have implemented. Okay? Again, thank you very much. We'll see you on our next website here next month, same time.
Oh, I think you may have cut out, but I think what Will was saying, same time, first Wednesday of every month. And we'll see you guys there. I hope you guys have a wonderful day.
You too, Will. Bye.
Bye.